Hi, my name's Tamia. I'm a student physical therapist assistant, and today I have my grandma here, and I'm going to be doing some special tests and assessments on her for her spinal condition. So she actually has foraminal stenosis, and I want to say L2 through S1, and it's more severe in L2, 3, and 4. And she actually, I think like 2 or 3 years ago, had surgery to fuse her spine because it was unstable and causing her a lot of pain. So now she kind of still has she gets some back pain. She does go to physical therapy, but she also gets some radicular symptoms from her low back into it could even go all the way into her big toe on the right side. So we are going to go ahead and do a couple tests to assess her stenosis. So first test that I'm going to have you do is the slump test. I'm going to perform this test because she does have radicular symptoms, so we'll see if it reproduces it or not, considering that she had surgery. Okay, so since it's on your right foot that you get those nerve symptoms, you're going to kick your foot out straight, and then you're going to bring your toes towards you, and then you want to slump your back, and then try to bring your head down too. So really slump. Okay, do you have any of those symptoms right now?
No.
Okay, and then back, and then go here, and then do it again. So slump, and then go here. No, feels okay?
Mm-hmm.
And then again. And then we're going to do it one more time. You're going to slump, and then we're going to go. Does that feel fine too?
A little bit in the hip right there.
Okay, so she mostly gets symptoms when she inverts her foot. So that is the slump test. Then I can do another test to see if it gives her any symptoms or not. I'm assuming some of these are not going to reproduce her symptoms since she has had surgery, but we will see. So I'm going to have you go ahead and lay on your back. Take your time. Okay, so I'm going to do the straight leg test to see if any of her symptoms are reproduced. So you're just going to relax. I'm going to bring your foot up. Okay, do you have any symptoms?
Yeah.
Okay, so I'm also kind of looking at her range in this leg. And then I'm going to try this leg just to see. Okay, and then try. Go ahead and do this leg again. Okay, what about there?
Yeah, just a little pulling right here.
Okay. Okay, so that was a straight leg test. So now I'm going to go ahead and measure her range of motion, Again, she does go to physical therapy for this, so she's actually doing pretty good right now. So I'm going to do her hip flexion range of motion. Okay, so I'm going to go here, and then we're going to go ahead. Actually, I'm going to do it with your knee bent. Go ahead and bend your knee and try to bend your knee. Actually, yeah, that's fine. Okay, so her hip range of motion is at like 1. No, let's see. Okay, her hip range of motion is at about 65 degrees, and then I'm assuming it's pretty much the same on this side. It's gonna be kind of hard to do it, but we'll try. not my ideal position to be in, but does that kind of hurt?
Yeah, right there.
Okay.
That muscle.
Let me see what we're at here. So this one's, the right side is significantly less. So she was at 50 degrees on the right side, and that is the side that she gets a lot of symptoms on, and she also had a little bit of pain during that range of motion measurement. So what we could do exercise-wise is more flexion-biased exercises. Since she does have radicular symptoms, it has also affected like pelvic floor nerves, so we can work a lot on core as well. So the first exercise that I'm going to have her do is I'm actually going to have you do pelvic tilts. So you go ahead and bend both your knees. And I think you've done these before, but you're pretty much just trying to get rid of that arch in the flat of your back. So you're going to inhale through your nose. And then as you exhale through your mouth, you're going to press your lower your back into my hand. Yeah. Okay, so let's do like 5 of those. So I have my hand here just as kind of like a tactile cue to see if she is pressing her back into my hand, and she is. And this is good to kind of work on abdominal bracing. This is a good one to start off with so that throughout her exercises she can focus on this, and it also helps with the pelvic floor. I could even put like a Pilates ball between her knees and have her adduct a little bit. Okay, we'll do one more. Okay. Good. So the next one we're going to do is we're going to do a knee to chest stretch, but we'll do single leg. So we'll see how this goes. So go ahead and straighten out this knee. And then are you able to grab your knee and pull it towards your chest? You can even grab from under in between. Good. And then I'll have you hold, ideally you would hold it for like 30 seconds, but we'll hold it for like 10 for video's sake. Just make sure you're breathing. So this is kind of stretching out her glutes, stretching out her low back, and getting her into a more flexion biased position. Good. And then you can go, we would do both sides. So you can go ahead and switch. Okay, and relax. Okay, and then next one, I'm going to have you go ahead and sit up. Take your time. Okay, next one, for the next intervention, we're going to do some nerve flossing. So what you're going to do is you're going to kick out your right leg again. And then what you're going to do I'm going to have you point your foot down and in a little bit. And then you're going to, as you do that, you're going to kind of slump down. And then as you come back up, you're going to put your foot back to normal. Good. And then, so you don't really want to hold it for very long. So here, and then back here, and here. And so we would do, I'd probably have her do like 1 or 2 sets of 10 on this one. How does this one feel? Do you feel any pain with this one?
No.
No? Okay. Okay, so those would be the 3 exercises I would have her do maybe on her home exercises so that they're easy to replicate when she's at home. And yeah, thank you.